I'm Chris Thorpe. I'm the occupational therapist for the neurological program at the Rehab Center at Parham Doctors Hospital.
And I'm Melissa Poole, the physical therapist for the neurological program also.
The Lee Silverman voice treatment is also called LSVT, and it's a specific training program for patients with Parkinson's disease. It focuses on increasing the amplitude of their voice and also of their gross motor and fine motor movements. It's administered by physical therapists, occupational therapists, and speech therapists. The treatment protocol started with Mrs. Lee Silverman. She was the first patient to receive this treatment while it was still in its research phase. She received what's called now the LOUD program, and the LOUD program is administered by the speech therapist, and it focuses on increasing their quality and their amplitude of their voice production. Since then, the BIG program has been established, and the BIG program is administered by a physical therapist or an occupational therapist, and that focuses on increasing the amplitude and quality of their overall movements, including their gross motor movements and their fine motor movements.
The LSVT program differs from traditional therapy in that it's administered in an intensive fashion. So patients are seen 4 days a week for 4 weeks.
In order to provide this treatment, a physical therapist, an occupational therapist, or a speech therapist has to go through specialized training. It's either an on-site training program or an online training program, and it requires over 12 hours of training in order to administer this treatment.
So treatment consists of an exercise portion, a functional task portion, and a walking portion. The treatments by PTs and OTs overlap in many ways, but differ in the primary focus and goals. Physical therapy focuses on strengthening of the legs, core, and postural muscles. It also focuses on increasing range of motion and flexibility of the lower extremities and improving balance during everyday tasks.
Meanwhile, when an occupational therapist is administering the program, their focus is on self-care skills, so bathing, dressing, feeding, handwriting skills. In addition, they're looking at the function in terms of strength, flexibility, range of motion of the upper extremities, as well as fine motor control.
Improvements we've seen in patients after the LSVT program are increased walking speed, improved walking pattern, improved overall strength, and improved ability to maintain upright posture for longer durations during daily activities. Patients also have seen improvements in balance in their everyday tasks in the community. We've measured improvement in gait speed and balance by using the timed up and go test. This is a test where patients are timed from when they stand up, walk down 10 feet, turn around, and come back and sit down.
Since starting this treatment with our patients, I've noticed that an increased independence in their ability to complete self-care skills. Also, they've been able to complete their self-care skills in a more timely fashion. They've been safer with their self-care and also with their functional transfers. And what we mean by functional transfers is car transfers, getting on and off the toilet, in and out of the shower. I've also noticed that patients have demonstrated less facial masking. They're able to smile more. Parkinson's disease is a progressive disease, so it's very important that patients continue to follow up with us for what we call tune-ups, just so that they can have a refresher with their exercises and also to address any decreased independence with their self-care, their walking, or their functional transfers. It's very important that they maintain their exercise program at home and comply with it daily and preferably twice a day. Here at Parham Doctors Hospital, we have a great team approach.
We collaborate to provide patients with the best possible care.